Hello, I'm Jason Robo. I host the weekly thought-provoking stand-up show Comedy for a Change, Saturdays 2 to 4 on KMUD. Today I'm applying my academic acquisitions to work with a special public affairs show on human health during the pandemic. Besides my political science, economics, and journalism background from Humboldt State, I am also certified in personal training by the American Council on Exercise, plant-based nutrition by Cornell, and the science of well-being by Yale. I had the honor of chatting with Dr. Michael Greger. He is an infectious disease and nutrition expert and author of many books. Most relevant to our discussion today is his How to Survive a Pandemic. Greger founded the nonprofit website nutritionfacts.org and advocates lifestyle choices to prevent and cure our vastly preventable diseases. Aside from predicting TP shortages during a pandemic, his 2008 Pandemic Prevention Lecture explains the origins of most infectious diseases from domesticated animals. For instance, influenza came from the guts of ducks and evolved airborne in the rice fields of Asia. Coronaviruses are inert in bats, a reservoir species, but deforestation and factory farming are creating exposure to livestock and evolving these viruses for the worse in livestock operations. For instance, MERS, a 2012 coronavirus outbreak in camels, came from factory farming them to keep up with demand. If infected, more than 1 in 3 die from that coronavirus. Greger considers COVID-19 a dress rehearsal for far worse diseases that lurk while industrial civilization continues to tempt fate. My audio came out a little garbled, so I re-recorded my questions, FYI, and Greger joins me from Seattle.
Let's rock and roll.
You advocate a plant-based diet, and I've heard dogs can go plant-based. What do your dogs eat?
Oh, what do the dogs eat? I eat whatever the vet tells them to eat. I as a physician, I'm a veterinarian that only knows one species, a very narrow veterinarian, and so I leave all the dog issues up to the vet.
My dog eats natural balanced vegetarian formula with some meat-based treats, by the way. Have you heard yet from Big Broccoli, and will you be known as Greedy Greger, trying to make people healthier in some weird sort of conspiracy?
I have yet to get the check from Big Broccoli, unfortunately.
Being a comedian, I can relate to your stories on going on the road to spread the word. As far as wordplay goes, you have so many amazing puns in your books and podcasts and whatnot. Do you have a bunch of writers locked up in a penitentiary?
I love it. Oh my God. No, that's half the book. Half the book is me just trying to come up with puns. Yeah. I mean, basically most of the time I just cheat. I just, you look up, any word in the world you Google it with the word idioms, and just come up with like hundreds of uses of that particular word. And so they'd be like, all right, I'm writing a thing about whatever, the health of the brain. And so you just look, and there's like, it's like 500 sayings that use brain in it. And so you just go one after another. I'm slogging through them, not using any innate ability whatsoever. It's just like, brute force this shit. And then finally, I'll be like, oh, that's good. Oh, yeah. And then it makes it into the book, and I sound much funnier than I am.
I was lucky you chose one of my questions at Plant Stock 2020. I've read Michael Osterholm's book, Deadliest Enemy. You cite him heavily in your book, How to Survive a Pandemic. I was curious, have you spoke with him this last year? He seems very invested in vaccines as a solution. The CDC has said that 94% who have died of COVID had pre-existing conditions, and I wonder how many of them could have been saved with a larger focus on healthy lifestyle advice rather than just masks and lockdowns.
Well, so I'm a huge fan of Dr. Osterholm. He's at the Center for Infectious Disease Research and Policy at the University of Minnesota. In fact, you want to know what's happening with the pandemic best out there, where I get my up-to-date information, check out his podcast, The Osterholm Update. Really, really good stuff. And he's only pro-vaccine because he's looked at the science and listening to the independent panels of scientists. You don't listen to big pharma, right? AstraZeneca just got in trouble for trying to tweak their own numbers, make them look better. You never listen to big pharma, but we are in this this blessed time where literally tens of millions of people have been vaccinated. They have been the human guinea pigs. So if you haven't been vaccinated yet, you're like the back of the battle, and they've already gone forward and they hit the front lines. And so now we know how safe and effective they are. And so it encourage people to get it. And you're saying, wait a second, I'm young, healthy, I don't have any of these pre-existing conditions. I'm not going to, what's the big deal if I get sick? The big deal is killing your grandma. The big deal is hurting those that you love. Is everyone in your circle healthy? Does no one have heart disease or diabetes or high blood pressure or obesity? You don't know anyone who's fat? Come on, right? You're going to hurt somebody. You could get it, pass it along. You come out fine. A week later, they end up in the hospital on a ventilator. So we're not just protecting ourselves, we're protecting the ones we love.
I'm a bit critical, and I appreciate your focus on prevention. I made that an issue actually at a town hall meeting on healthcare with our then Congressman Myq Thompson. The crowd clearly agreed that prevention is underrepresented in the dialogue, and I have a video of that online. Most attendees discuss stories with difficulties in the so-called healthcare industry. I'm curious, are we going to keep shooting ourselves in the foot with these new infectious diseases and just having to get more shots? I'm concerned that that is our trajectory from this point on.
Yeah, no, I couldn't agree more, right? I mean, think about the risk factors for a severe course of COVID-19: high blood pressure, diabetes, the heart disease, obesity, right? These are all completely preventable, arrestable, sometimes reversible with a healthy enough plant-based diet and lifestyle. And so the debate about healthcare is who's going to pay for it, instead of what kind of healthcare do we want. Ounce of prevention worth way more than a pound of cure. And even if we do have vaccines, it takes months for them to come out. In the best case scenario, lots of people could die in the meanwhile. And so that's why we need to be healthier ourselves to be able to risk infectious assaults, as well as preventing the emergence of pandemic viruses in the first place. And that really comes down to our treatment with the animal world, right? Most new emerging human diseases come from animals. AIDS virus, been blamed on the butchering of primates in the bushmeat trade in Africa. Mad cow disease, right? Because we turned cows into herbivores, from herbivores into carnivores and cannibals. SARS, COVID-19, the exotic wild animal trade. Our last pandemic, though, swine flu in 2009, arose not from some backwater wet market in Asia, but was made in the USA on pig operations right here in the States. Thankfully, it only killed 500,000 people, but the next time we might not be so lucky. So it's about, getting rid of factory farming and they're the ones who could use a little social distancing. The animals need a little breathing room at this point. Otherwise, we could be setting ourselves up for something even worse down the road.
Some of my critical jokes about masks is that they will help more in proximity to fast food joints.
Strap that shit on, right?
With the subsidies, they've made it impossible for everyone to eat healthy. They've literally tossed the salad.
No, exactly. Right. The reason that there's dollar menu meat is because they are able to externalize the cost to the rest of society, and their feed costs are subsidized by taxpayers. We subsidize the sugar industry. We subsidize, so it's like we're paying to make for unhealthier foods cheaper, and then we're overwhelmed with healthcare costs. It just doesn't make any sense unless you are part of big pharma or big ag, in which case you're just raking it in while people are dying.
What do you think of the product Athletic Greens?
You mean like green powder kind of supplement kind of things?
It's supposed to be the best thing you could get in lieu of fresh vegetables.
Yeah, I'm skeptical. You can get frozen vegetables anywhere. That's going to be healthier. Worse can worse, you can do canned vegetables, but you're actually eating vegetables. It's very difficult unless you're eating literally like a kale powder. Like I actually have kale powder. It's just one ingredient, kale. That's it. It's just powdered kale. And you do all sorts of fun stuff with it. You can sprinkle on popcorn, whatever. The first ingredient should be greens and not, maltodextrin or whatever cheap filler. It's just really, I don't know. It's expensive to actually use real food.
I interviewed Dr. Hana Kaliova, Director of Research at the Physicians Committee for Responsible Medicine, and she gave a ton of easy, awesome ways to boost one's immunity, like mint tea. I appreciate how in your book, besides explaining how we are creating diseases, you also explain a lot of diet and lifestyle strategies. I find it upsetting that the media focuses mainly on fear, wearing masks and vaccines, and not taking care of one's own health. Do you find that frustrating?
It's ridiculous. I mean, look, even being, you don't even have to be obese. Even just having a BMI of 28 puts you at about 5 times the risk of a severe COVID-19 course. The average BMI in the United States is 29. So even being skinnier than the average American can put you at so much excess body fat that you have more than 5 times the risk of a severe COVID-19 course. Look, it's been a year. No matter however fat you were in, March of last year, look, you're not. Most of us aren't walking past the donut shop anymore on the way to work. All right, we don't have coworkers with bowls of candy on their desk. Our kids aren't having cupcake celebrations in schools. Like, this is the time we have control over our food environment. You can clean out the pantry, start that exercise program you always wanted to do, or that meditation practice, or whatever it is to clean up your lifestyle, protecting you not only against future chronic disease, but right now against the current infectious disease threat. No excuse.
Have you happened to hear about the Pando Forest? I discovered it on a road trip recently. It has the same word root as pandemic for spreading easily. They are all identical clones of the other trees and are at least 10,000 years old.
Oh, it sounds pretty.
Of course, they are endangered while pandemics flourish.
Where's it located?
It's in Utah at the Fish Lake National Forest.
Cool.
In the COVID-19 tests, how do they detect variants versus various strains of coronaviruses?
Yeah, they're picking up pieces of the genetic code that are indeed unique to COVID-19, including all the variants at this point that could change in the future. But you get a big enough sequence, you can have, point mutations along the way. You're still going to pick it up. Now, that's not all the tests. There's also antigen tests, which actually just look for your antibodies in response to COVID-19. And that's kind of a proxy for exposure. But unfortunately, you don't get a sense of whether it's a new infection or an old infection. That's why the DMA testing, the PCR testing gives you a sense if you're actively, shedding virus at the time.
Do you happen to know Myq Kaplan, the comedian?
Oh, yeah.
Have you heard of his work?
Myq, right?
I bet you'd be hilarious together.
Yeah. I've seen him. I've seen him twice.
Right.
We kind of run on similar kind of tours and cruises and stuff. Yeah, no, he's hilarious. Love his wordplay.
I've got a good friend in the hospital recently for kidney issues. Will you have any books coming up on different organ systems, like How Not to Dialysis? For example.
There we go. How Not to Diabetes. There's a whole bunch of them.
There you go.
Yeah, no. Well, so, obviously there's a chapter on how not to die from kidney disease in How Not to Die. But I am, after my How Not to Age book, which will be out December 2022, I believe the next book is going to be on eating for cancer survival. So that'll be kind of a How Not to Die from Cancer kind of thing, just because it's so enormous. And then after that, I think I'm going to do look at mental illness and diet. Yeah, there's lots of good fodder out there.
Back to Osterholm. I've listened to his podcast over the past year. I did lose a grandmother, 97 years old, in a nursing home. My other grandmother turns 100 soon and was in the news when she got her vaccine. Osterholm did one episode on mental health, but I feel like that he's neglected doing anything on diet, and I would like to nudge you into making that happen.
Yeah, no, he holds such sway, particularly now in the administration. I'd love to see them dip their toes in the water diet.
You're in the film They're Trying to Kill Us. Documentary has not been released. Do you know when it's coming out? It's been delayed from the pandemic.
I've heard great things about it. When's it out?
I thought you knew.
I'm waiting with bated breath. Seaspiracy just came out, which I'm in. It hit Netflix, I think, yesterday. So something you can look at while you're waiting.
Thanks for your work and time. Greatly appreciate you.
I love it. Peace out.